Alright, well, we have a surprise for you. It's the return of the most famous superhero fighting force the world has ever seen. No, not X-Men. It's almost as famous. It's,
Team Super Helmets of the Intestinal Tract.
with American Dude, Lumbering Tree Man, EO Slingshot Kid, and Strong Guy. Well, if you don't, you've been missing out, but you'll learn them soon enough. So let's start drawing the scene. In the underbelly of Nematodes City. It's just another night in this city where justice never sleeps. But in the shadows lurks a new evil. It's our first nematode. Vermin Lady. She's Enterobius vermicularis, also known as the pinworm. The name vermicularis sounds like vermin, hence our evil supervillain Vermin Lady. And she's crawling out of a round hole here that was drawn to look like, well, an anus. Why? Well, with Enterobius infection, at nighttime, the female worms migrate down to the anus and lay their eggs. So to show you this, we'll include some small round rocks strewn about the anus-like hole. Alright, so we're drawing some baby rats too, with little pinworm tails, and they're eating old food right by the hole to represent that this is transmitted via the fecal-oral route. What's even worse is it's really, really itchy. So infected individuals scratch down there and end up putting their fingers in their mouth. And this can even happen while they're sleeping. So yeah, that's pretty gross, but I swear I'm not making it up. So people with pinworms end up infecting themselves over and over again. This disease typically affects children because kids are gross and have fewer inhibitions about putting their poop hands in their mouth. So how do you diagnose this? Well, that's where a handy household item called Scotch tape comes into play. You see, if you press a piece of tape on the anus in the morning, the eggs deposited over the last night will stick to it. So I have a question for you. Who the hell discovered that? I'm not sure whether I'd want to applaud them or take their license away. Maybe it was an ingenious marketing ploy at the Scotch tape corporate office. Anyway, the eggs should be visible on the tape under the microscope. So to remind you of the Scotch tape test, we'll draw in a long, thin, translucent cape that looks like Scotch tape with a few of those little round pieces of rubble stuck to it. Alright, so let's talk treatment. There are two main drugs that you can use, and the more common one is parental pamoate. So we've got our superhero saving the day with a PAM, right to the Vermin Lady's back. PAM for parental pamoate. And the other drug you can use is albendazole. Soon you'll see that all the intestinal nematodes that we're going to draw in this scene can be treated by bendazoles. To show this, we'll add some metal bars to the sides of the intestinal subway tunnel. See how they're all bent? So these bendy bars will be our recurring symbol for bendazoles. So who is this superhero saving the day? And look at all those shiny rings of justice around his neck and ankles. That's to remind you that he's our symbol for Ancylostoma duodenale and Necator americanus. Ancylostoma for ankle and Necator for neck. And he's American Dude to remind you of Americanus and duodenale. Ancylostoma and Necator are two types of hookworms that are found in the rural southern United States. So of course he's swinging using his trusty hook shot, and check out these big red boots. He's wearing them to remind you how the parasite infects the host. The way you can get infected is by walking barefoot. In fact, the larvae penetrate the skin of the soles of the feet, and once inside the bloodstream, they go straight to the lungs so they can ascend the bronchial tree and make their way all the way up until they get coughed up and swallowed. Then they mature into adults in the small intestine. It's such an insanely circuitous route, it's pretty incredible. Anyway, to show this worm's incredible voyage through the bloodstream to the lungs and then back down in the small intestine, we'll give him a cool design on his superhero spandex suit with an arrow pointing up to the lungs and then back down to the GI tract. Now, these are some serious bloodsuckers. They attach to the gut wall and feed from the capillaries in the intestinal villi. So these patients can develop a severe iron deficiency anemia, which will signify with this iron dangling from the end of the hook shot. Notice the microcytic and hypochromic little steam holes on the bottom? So to diagnose this infection, you'll find its eggs in the stool. Notice some of America Dude's little round grenades have fallen into the puddle of water? This is to remind you to look for eggs in the stool. You should also look out for a high eosinophil count. Remember, eosinophils are those white blood cells with little pink granules and bilobed nuclei. Every superhero needs a trusty sidekick, so in comes Eos Slingshot Boy with his trusty bilobed slingshot and little pink granule ammo. Again, he represents eosinophilia, and he'll be a recurring symbol throughout the parasite videos. Once again, we've got the bendazoles, or PAM, parental pamoate, as the two drugs you can use to treat this infection. But probably most important is to wear shoes. Parental pamoate will be the choice for these two parasites only, which is why we have PAM written between the two of them. The next intestinal nematode I'll talk about is Ascaris lumbricoides, the giant roundworm. Lumbricoides will be symbolized by this huge lumbering tree man, which should tell you that we're dealing with a large worm. It's transmitted by eating eggs that are in contaminated food or water, and once the eggs hatch in the small intestine, the larva migrates through the gut wall into the bloodstream and makes its way to the lungs. Once there, they go through the capillaries into the alveoli, and of course it doesn't stop there. They too ascend into the bronchus and then are swallowed back down again, and they mature into adults in the small intestine. These adults multiply, and their eggs get passed into the feces and restart the cycle of infection. So again, this life cycle will be depicted by the super spandex suit. Superheroes are powerless without their matching spandex suit, and remember this symbol is showing the bug traveling through the lungs and back into the small intestine. Notice that unlike American Dude, Lumbering Tree Man doesn't have red boots, so Ascaris doesn't enter through the feet. As you can imagine, if this keeps on happening, you can get a pretty big buildup of these worms. Although some people are asymptomatic, others might have signs of malnutrition or respiratory symptoms as more and more of the worms migrate into the bronchus. Of the worms that travel into the lungs, Ascaris lumbricoides is the most likely to cause respiratory symptoms, which we'll emphasize with this leaf on his chest that looks like the bronchial tree. But even worse, the major complication of this infection is intestinal obstruction that occurs most often at the ileocecal valve. We'll have the lumbering tree man blocking a bunch of rubble from passing into the tunnel. He's obstructing the tunnel like Ascaris can obstruct the ileocecal valve. Now, how do we diagnose this? Well, looking back at the life cycle, you can probably guess that you can find eggs in the feces. And this is represented by the little acorns dropping into the puddle here. Also, patients typically have high eosinophil count, so don't forget the Eos Slingshot Boy and his granules. We'll add some more eosinophilic granules around the lumbering tree man. Now, how do we treat this? Well, I already spoiled the answer in the beginning of the video by telling you all these bendy bars treat the worms in this video. So use a bendazole. Bendazoles work by causing microtubule dysfunction and eventually makes these worms immobile. But if you immobilize a ton of worms, then you can actually induce obstruction by using this drug.
We're not illustrating this, but just keep in mind, don't give microtubule inhibitors to pregnant patients. Instead, you would consider using PAM, aka parental pamoate.
Alright, now for my personal favorite superhero, Strong Guy, aka Strongyloides stercoralis. Strong Guy here is wearing these big red boots to match American Dude, and this is because Strongyloides larvae penetrate through the skin on the bottom of the feet. Also like American Dude, when it gets into the blood, it goes to the lungs, climbs the bronchial tree, gets swallowed, and matures in the GI tract. So we'll have Strong Guy fit in with his companions by giving him this matching hero insignia on his chest. Additionally, Strongyloides can further propagate by auto-infecting its host, in which case it lays its eggs into the intestinal wall, and from here the larvae hatch, repenetrate the intestinal wall, and make their way into the bloodstream so that they can travel to the lungs. So let's add some round rocks inside the hole that Strong Man has kicked into the wall, as if he's nesting into the side of the intestine and laying these little eggs. If the patient is immunocompromised, the inflammation from this continual wall penetration can lead to hyperinfection and dissemination of the worms. So now you can see why Strong Guy is my favorite. While the other heroes are saving the day attacking Vermin Lady and holding back a rock slide, Strong Guy is off to the side practicing high kicks against the wall. Useless. So to make this diagnosis, there's something you gotta remember. Since the eggs are laid into the intestinal wall, they don't get passed into the stool, and instead you'll only find larvae which have already hatched from the eggs and crawled out of those holes. Notice how some of these larval worms are escaping from the busted open wall and falling into the central lumen of the picture. They're landing into this puddle to remind you to look for larvae in the stool. We'll also add a few more pink granules to remind us of eosinophilia. Eosinophil granules everywhere. There are 2 drugs that you can use to treat Strongyloides infection. Well, you know one, albendazole, signified of course by the bendy bars. And the second one is ivermectin. When you see the word, think rivermectin, which will symbolize with this no dumping drains to the river sign. So river for rivermectin. And just when you thought the forces of evil were no match for this super spandex-clad team, an evil trickster lurks in the shadows. Porky Trickster, half swine, half man, all evil. Notice the spirals on his suit? That's because he's our symbol for Trichinella spiralis, an intestinal nematode that you find in undercooked meat like pork or bear. Infection with Trichinella causes a wide range of symptoms, including fever, vomiting, and periorbital edema. So let's give this evildoer large red glasses to represent periorbital edema, and he'll have some green drool and big drops of sweat because he's been vomiting and having a fever. Man, you don't look too good, Porky. Trichinosis also causes severe myalgias, or muscle aches. Why? Well, I'm glad you asked. After ingestion of the cysts, from where again? Right, undercooked meat. These cysts develop into larvae, then they enter the bloodstream and form cysts within the striated muscle cells. Let's draw some red pipes to represent the bloodstream, and we'll color the brick wall to look like striated muscle. This evil little pig has planted all of his cyst-shaped explosives into the wall, and it's starting to do some damage. It's blowing a hole into the wall, so let this explosion in the muscle wall with fire remind you of the muscle inflammation that leads to myalgia. Here are the last of Eos Slingshot Boy's granules for eosinophilia, and don't forget bent bars signifying that he too can be treated with albendazole. Well, that's it. Will American Dude and the rest of the uncanny spandex team make it in time before he sets off the detonator and blows the whole world to smithereens? Find out next time on
Team Super Helmets of the Intestinal Tract.